Okay, so I think that's probably enough time for everyone to join. And so thanks very much everyone for coming. It is nice to see so many people here. And so this is our one of our admissions webinars talking about the Master of Public Health, the MPH. And just a few introductions to start with. So I'm Anthony Laverty. So I'm a senior lecturer here at Imperial. I work, alongside the teaching. I do quite a lot of research on tobacco control. What can we do to reduce the harms of tobacco? And also sort of separately on transport. What do we know about the transport system? How is that influencing the health of populations? Henok, do you want to introduce yourself and then Zainab?
Hello, hi everyone. My name is Henok Tadesse. I'm a principal teaching fellow in public health and co-director of the Master of Public Health course. And yeah, very nice to meet you all and looking forward to discussing the course with you today. Zainab?
Hi everyone, I'm Zainab. I'm the course organizer of the Master of Public Health, senior teaching fellow in public health. Yeah, I'm looking forward to speaking with you today.
Great, thanks, Zainab. We've got a bit of an echo. Oh, that's seems to be fixed, and so Joe has sort of said in the chat. So if people have questions, if they want to put those in the chat, either we'll sort of answer them as we go along in the chat, or we can sort of discuss them with everyone at the end. And are you okay to go to the next slide, Zainab, please? And so, yeah, so this is the MPH course team. So three of us are here. So Azim Majid, who isn't here, is the course chair and also the head of the Department of Primary Care and Public Health here. And then we've got a few more slides sort of talking about the team, the people that you will see and hear from on a regular basis. So Joe and Sylvia are sort of here on the call. And also Lauren, who isn't, are really, holding everything together behind the scenes so that everyone is having the sort of best experience, learning the most that they can. And we've got one more slide of people's pictures, I think. Is that right? And then so also, I mean, I guess, so we make this sort of three-way, distinction. There's, sort of teaching staff who'll be sort of delivering, what you're learning in the rooms. The admin staff are, making sure everything runs smoothly, that those sort of processes are working, everyone's in the right place at the right time, everyone has the right things. And then alongside that, we have the support team. And so, that's really, as the name suggests, sort of support people through through their year in London, through their experience. And so sort of key people there are Jenny Husbands, and so she's the senior postgraduate tutor, really, looks after people as they have sort of like issues on the course they want to talk about, in their personal life or in your private life, or even, or also, issues do come up. And so Jenny is there for that. Sunjas Hasuna is our professional skills support lead. So, she is, the person really to go to about sort of, not concerns, but, thinking about, what are you going to do after the MPH? How are you going to get a job? What type of job is going to be best for you? What are the skills, competencies employers are looking for? And then she's supported by Wendy Kwok. So this is the sort of team of people, behind the scenes, and here they're sort of holding the MPH together. Next slide, please, Anna. So I guess to get a little bit more specific on the Imperial stuff, why should you come to Imperial? Why should you do the Master in Public Health? So you've come to this webinar, so you've signed up. So I assume you have some interest and understanding of what the MPH is, what Imperial is. And so just to say, I mean, personally, so I joined Imperial 15 years ago this month, and so I sort of joined as a lowly, as it were, research assistant. You know, so the bottom of the bottom of the research ladder, as it were. Sort of did my PhD here, and I've stayed, and you know, and there's a reason, lots of reasons I've stayed here for 15 years. One of them is the quality of research, the quality of sort of people doing that research here. And that will really, you know, that really bleeds across into what we teach. So every sort of 7 or 8 years or so, the UK has this process called the Research Excellence Framework, the REF, and across all different subjects, all different universities. Universities sort of submit their best work, and they are ranked by their peers to come to this assessment of, you know, how well are different universities doing in different subject areas. In the area of public health research, Imperial came top. So it was the best research of all of the UK universities in public health research. The highest proportions classed as being world leading research, and so these are the results from the last ref. Also in this sort of research to teaching link, I think, you know, Henoch will talk about this a bit more, sort of getting into the details of the course, but I make a distinction, really. You know, we've got a strong focus on, you know, doing public health research, you know, trying to influence policy, you know, through finding out what works, you know, what can the methods of science, you know, teach us about the public health and what influences it. But also, and so you'll hear a lot about that research, and you'll be sort of taught by people who are doing that world leading research. But also we then have a real strong focus on those research skills, right? So as you would imagine, you know, lots of great research at Imperial, and then that means that through the MPH, in contrast to some of the other MPHs around, we have a real strong focus on, you know, teaching you those research skills, so that at the end, you know, you're in a good place to sort of lead and perform this research yourself. Also worth saying that we do a reasonable amount of research on teaching, right? So a lot of the people who are teaching you, you know, have, you know, studied and thought about pedagogy quite hard, and that really informs, you know, how we design and deliver the course. So, you know, we've got that research focus from different angles. The next slide, Zena, please. So this sort of just gives a little bit more detail on these ref results from the last time that happened. And next slide, please, Zainab. And so outside of just, you know, how are we doing in the public health research, Imperial's, you know, world leading on a number of measures, rated as first in the UK and Europe, and second in the world on these QS university rankings. You know, there are different rankings which give different positions to different universities, but you know, I think it's fair to say that Imperial consistently comes high up on those. Guardian University of the Year 2023, top for graduate employment in 2024. So, you know, really Imperial is a great place to be, learn lots of things, meet lots of great people, have a nice time in London, but also, you know, all of these academic things are happening in the background. And then next slide, please, Zainab. And so this is the last slide from me. And so this is just sort of gives you a bit of a flavor of the range of public health research that is sort of going on here at Imperial. So I made this slide yesterday, just going through the Imperial School of Public Health news site, you know, things that have been happening. And there's a real, you know, huge range of things that are happening. And so, you know, a few of the examples here is, you know, Lord Mayor of London event exploring solutions for global health and well-being, you know, speaking to our interest firstly in global health, but also our, efforts to try and work with policymakers at a number of levels. So, next, we had the mayor of Freetown presenting at an event, think about urban resilience and climate adaptation. What can we do? What can we do there? Strong focus on nutrition, as you would imagine, nutrition, one of the big drivers of global health and ill health. So, influential research on changes in food allergy, which we is probably often under considered, but so we have people working on that. We have a lot of research interest in ultra processed foods, UPFs, and so that a sort of evolving research area, which is really sort of, come on the scene in the last sort of 7 or 8 years, and lots of big studies run by Imperial there, also trying to make some headway and in terms of what can countries do about this. As I say, we have this research on, how can we teach things? So, and we've had events around, teaching tools. What is the best way to do these things? Can you use different digital tools? What is the most effective AI health checks? Can we use the power of big data and the processing that enables to, work out how healthy people are and where we should target interventions, the double burden of malnutrition in Peru. So if you're not familiar, the double burden of malnutrition is that in the same countries and even households, you can have people who are both undernourished, but also people who are overweight and obese. So undernourished on, certain measures of macro and micronutrients, but also can, be overweight and obese. And that's, a real thorny problem, which we're making big efforts to try and solve. COVID work around malaria vaccines and childhood obesity. So this slide just gives a bit of a flavor of the range of research that is going on at Imperial. And I think I'm going to hand over to Henok, who's going to talk in a bit more detail about the course.
Thank you very much, Anthony, and thank you everyone for joining us today. So the key features of the MPH, it's a full-time, 1-year intensive course. We have a new School of Public Health building. So that's where a lot of the teaching will occur. Occasionally, you get to be taught at South Kensington, the business school campus. And it's aimed at candidates with health, biomedical science, management, and social science backgrounds. Public health is a broad church, and we do cater for all those disciplinary backgrounds in terms of our selection and in terms of nurturing you whilst you're here to develop your skills. Next slide, please. But just to say here that we do have an online version of the MPH, the online MPH program that has a slightly different structure, but basically delivered online and remotely. But if that might be an interest, please do visit the relevant webpage for the online MPH program. But the key distinction with that is you can actually apply for a PG certificate, a PG diploma, postgraduate diploma, or a master's course on the online version of the course. With us, you have to enroll for the full master's, depending on if it so occurs that you've just completed the first 2 terms and for any given reason you can't complete your dissertation. We do consider exit awards at the postgraduate certificate or postgraduate diploma level, but the enrollment for the on-campus program with us has to be for the full master's program. But for the online program, you could, if you wanted to have a test or if it's, the certificate is all that you're interested in, you could register at all these different levels. So I've already covered this. As Anthony was saying earlier, we've quite developed our teaching methods by combining a mix of online and blended delivery. By blended delivery, what we mean is that there is an independent study time allocated for you. We've curated and developed high-spec teaching materials that we actually expect you to cover ahead of the live teaching sessions. And the live teaching sessions are more of interactive, engaged, more to develop your deeper understanding into the concepts being discussed. And then all the efforts over the year culminate in the final dissertation project that you'll undertake with close supervision, which Zainab will explain further on later. So the core objectives for our course are can really boil down to 4 key objectives: providing a comprehensive introduction into key public health topics, which are health promotion, health protection, health behavior, health policy, health economics, financing, all these different subfields within public health will be covered over the course of the year. But also there's a real focus within our course on offering cutting-edge knowledge and skills base in these key principles, and also the methods of public health. As Anthony was saying earlier, we do place a lot of emphasis in your research readiness when you complete our course. There's a lot, and then we'll describe how that focus is demonstrated. There's a focus on quantitative analytical skills for public health, epidemiology, and health services research. This doesn't mean that we don't cover qualitative research. We do cover qualitative research, and a number of our students go on to complete their dissertation using qualitative methodologies. But on the whole, given the school's overall emphasis on quantitative methods, our course is also geared towards enabling you to really have a good grounding in the quantitative analytical methods. Just to say how that happens, our modules are structured over one whole teaching day. So it's not just teaching you the concepts of how, the biostatistical concepts or the epidemiological concepts. There's also a hands-on tutorial session after the teaching sessions where you practice all those skills using databases and things. And it's also about providing a creative and supportive enabling learning environment. That's also very, very important to us. And I'll try to show you how that's expressed within our course structure. So the course structure, it really is, your year would be divided into 3 distinct terms. The first one involving intensive compulsory taught modules on the core concepts and techniques in epidemiology, biostatistics, public health, and research methods. And the second term is a mixture of one compulsory module, which is health economics, and then a lot of optional modules, as I'll be showing you shortly. And then the third term, from the 1st of May to around the end of August, this is totally dedicated to your independent research or dissertation work, which is closely supervised by academics from across the School of Public Health. So this is what your first term will look like. These are the big modules that we have, covering the 10 weeks of the first term, each allocated a day. So on the Monday, you'll come in and you'll undertake statistical thinking and data analysis. On the Tuesday, principles and methods of epidemiology. Wednesday mornings, we have different seminars aimed at providing further support. Wednesday afternoons are your independent times to engage in college-wide activities, societies, sport activities, and so forth. Thursday, fully dedicated to research methods, and Friday, foundations of public health practice. So these are what we called the core topics in public health. So with these groundings, we then go into the second term, which is structured quite differently. So this busy slide showing you over 22 modules around there, are a mixture of, you can see the health economics module on the Wednesday. That runs for 10 weeks, and that's a core module, but 5 credits will have. But then on the other days, you have this option of mixing and choosing from across all these optional modules. And your choice will determine what kind of concentration you get awarded on the end page. So these concentrations are what we call streams. So you could decide to sign up for the health promotion and service improvement stream, as long as you select for next year. It's going to be as long as you select 3 of these modules. Okay, so that will qualify you to have this tag on your final degree. It will be MPH with health promotion and service improvement stream, or it could be an MPH with quantitative methods stream, as long as you select either nutritional epidemiology, environmental epidemiology, infectious disease modeling, or advanced stats and data science. So we have other streams: infectious disease stream, environmental health stream, health policy and system stream, and global health stream. Really, we've been responding to students' feedback and looking at the key interest areas for students to develop their careers in the future. And so these streams have come from that kind of process, and they're very, very popular with students. But you still get the chance, if you don't want to be tagged, and if you want to choose as you like across the different streams, you could just go away with a general MPH degree. But just to simplify, because it's a very busy slide, we're not going to expect you to do all the 22 modules over one term. You get the option, so you could only choose 5 of these optional modules. If you have 1 or 2 open spaces within your calendar, if you're very keen on another module and you've already filled up your 5 allocations, you could still audit, or you could still sit in and be part of the lessons, but you won't be accredited for that extra module. And the final term, as I said, is totally dedicated for your research project. Zainab will go in depth into that later on. So we do different types of assessments across all our modules. So, we have the more classical academic essays, the group work and presentations, video blogs you'd have to submit, reflective statements, simulations, for instance, in the outbreak assessment in health protection, critical reviews, critically reviewing and appraising published literature. And so we have quite a mix of assessment strategies that will assess the different skills that we hope to cultivate within our student body. But we're not going to plunge you into these summative assessments directly. We also have structured formative assessments. For instance, as soon as you come on the course, we'll ask you to write an academic essay, which is not going to be assessed, but which is supposed to give you feedback so that you're primed as to the expectations of the coursework assessment, but also more generally around academic writing. But we have other formative assessments. For instance, on epidemiology, before you do your final exam, there's a formative exam that you would undertake, and you receive feedback, and based on that, you would attempt the final assessments. But all assessment dates, marking period, all the information will be detailed in module handbooks for each module, and also an overall course level assessment schedule, which we'll be sharing with you as soon as you join us. And this year, we've introduced this really innovative strategy to support student journeys that we're calling academic support groups with tutors. And a number of these tutors are alumni of our course who are working with in the School of Public Health, and ourselves included, and we meet with a group of, say, 10 or 12 students to continuously discuss about academic strategies, about about the available support resources within the college and outside, and to provide any tips and feedback whenever students might need these inputs. And there's ample opportunities to engage in extracurricular seminars. We also encourage students. We have the PG Forum, the Postgraduate Student Forum, which has been quite a success in recent years, and the students would organize student-led seminars, but also have in the past invited external speakers. We have our research departments across the School of Public Health, the Infectious Disease Epidemiology Department, the Epidemiology and Biostatistics Department, the Primary Care and Public Health Departments, the Aging Unit, the George Institute. All these organized seminars which we make available whenever the opportunity arises to students, but also we have the Imperial Graduate School, which organizes a similar. So as long as you manage your time and are organized to make the most of these opportunities, there are ample opportunities for extracurricular learning. You might have seen the WHO Collaborating Center, which is housed within the Primary Care and Public Health Department. Professor Salman Rawaf, the picture on the bottom left, is the director of the department, and they annually organize a visit to WHO and other agencies in Geneva. We're not able to take everyone on that trip because our cohort has increased over the years, so that's physically not possible to organize. About 35 students every year get the opportunity to go there, but we also but a lot of the visit is also opened up virtually to those who are not able to go. So especially the ones related to internship, career opportunities at WHO will be live transmitted, and you have the opportunity to participate actively. I think I pass on to Zainab now.
Thanks, Julia has gone. Thanks, Henrik and Anthony. So as both Henrik and Anthony said, there's a large focus on research, and we really start from term 1, where you're set up with the core skills to do research. And in your research methods module, you'll be coming up with a research question. And this can really start you thinking about what you'd like to research in the 3rd term. Now, the 3rd term research project is very much like an internship. It's very authentic. You're embedded within a research group with actual researchers across the School of Public Health doing real life research. You will have built up the skills over the course of term 1 and term 2 to do this research. And your term 1 modules cover all the methodology. And then the first step will be developing a research question in the research methods module, as I say. And then in term 2, you have 2 options. The School of Public Health will release a huge range of projects from researchers across the School of Public Health. So if you can have a look in the School of Public Health, there are so many research projects covering a huge wide range of topics. So you can start thinking early on about what topic you might be interested in, but perhaps you don't know. In that case, you can pick one of the research projects that will be released. So there's a big list released at the start of term 2, around February time. And then you go for the project, you select 3 in no particular order. And you go through a selection procedure, much like you would go for a job. Where you can explain to the supervisor why you're interested in the project, and they will select a student that I think is most suitable for the project. That's one option. The other option is to develop your own project. We will help you do that if that's what you want to do, and find you some supervisors in the topic that you're interested in. Every year we have several students that will do that and they're often really good and very successful projects. So once you've secured a project, sort of midway through term 2, since the project starts in term 3 at the start of May, you begin the project, and then in early June, we have a check-in presentation where we check that your research question is set and that you've got aims and objectives and you've got a plan for your project. And then throughout June and July, you're working with your supervisors. Often you have more than one supervisor, and they're usually an expert in the topic. And so, yeah, you can often have 2 expert supervisors working with you. So it's a really great opportunity to work in depth on a topic, apply and learn in-depth skills on the topic that you're interested in. And it's also an opportunity to network. So we've had lots of students develop connections through their project, go on to do either a PhD or go on to secure a job through their project. And then towards the end, once you submit your dissertation at the end of August, after that, we have a Viva where you have a presentation and we will ask you some questions on the project. Throughout this period, you have regular meetings with your supervisors, but we also have taught sessions throughout the summer term to support your project, such as, how we go through again, how to do your literature review, how to present your results, how to do presentations. So you have taught sessions throughout the summer term as well. So these are examples of past projects that other students have done. And as I say, in the School of Public Health, there is a huge range of expertise on any kind of topic that you can think about in public health. So we've got lots of expertise on nutrition, the food environment. We've got a lot of expertise on health innovation and health improvement. We've got a lot of expertise in the school on tobacco control. So there's always lots of projects on these areas. It's also possible to do some primary data collection, challenging since you only have 4 months, but students have done primary data collection. They've collected survey data. So this is an example of one done during just after COVID, actually, looking at dietary and lifestyle habits during COVID-19 and lockdown in UK university students. There was another survey done on physical activity, social interaction, community space. So every year there are a few primary data collection projects that are offered, where you'd actually be working with patients, with participants to collect the data. And we've got a lot of cohort data available within the school. So here you can see there's a few more looking at environmental factors, looking at smoking, and looking at the environment, our urban green space and respiratory disease. And then you've got another project on diabetes. So really any topic that you're interested in, it's likely you'd be able to find someone working on it within the School of Public Health. You can also make external collaborations during your projects, but you do have to have one supervisor that is based at Imperial. And often students do develop these projects into actual publications. So you can see this one is about access to primary care and visits to emergency departments. It's a cross-sectional population-based study published in PLOS One. And then you've got a meta-analysis on blood pressure, hypertension, and the risk of sudden cardiac death, published in the European Journal of Epidemiology. And this one was a qualitative study, community-based interventions for improving mental health in refugee children and adolescents in high-income countries. And this was published in the Cochrane database of systematic reviews. And then we have this one in the Journal of Adolescent Health, looking at the effects of exposure to tobacco and e-cigarette use. And it was an analysis using survey data. So hopefully this has given you an idea of the range of products. So here we've got another one, a qualitative study looking at reproductive health, and it's published in Journal Reproductive Health. So hopefully that gives you an idea of the range of projects that are possible, and also the range of methodologies that are possible on the research project. And then talking about careers and what people go on to do, there's really a huge range of roles and employers that students go on to, since public health is a wide-ranging discipline. So every year we have a certain amount of clinicians on the course, so they often go back to being a physician. or a public health registrar. And then we have a lot of people going on to analyst posts or research fellow posts. And these are just some of the different organizations that employ public health graduates. We've got the National Health Service, the Department of Health, we've got different policy organizations, think tank organizations, non-government organizations, startups, and then higher education and consultancy. But you just have to do a quick search on something like LinkedIn and type in MPH Imperial, and you'll see that people go on to really a huge different range of roles. These are just some examples of recent alumni. So we've got alumni working in industry. So for example, one is a healthcare strategy monitor at Deloitte. We've got another associate consultant for PricewaterhouseCoopers in the Middle East. In academia, we've got several people that go on to be a researcher or a clinical trial manager or a project manager within academia. And then there are various government public health organizations that also employ alumni, such as the National Institute of Health Research, the UK Health Security Agency, got various local authority public health departments, the Department of Health and Social Care. So, for example, a recent alumni is an infectious disease modeler at the UK Health Security Agency. And then you've got various non-government organizations, think tanks. So, for example, Policy Connect is an employee. World Obesity Federation is another example of an employee. There's a lot of career support available at Imperial. So the Imperial Career Service offers great services. You can book one-to-one appointments with them. They have careers fairs regularly. They have like professional development programs that are specifically tailored for master's students. And then within the program, we run regular School of Public Health career sessions where alumni are invited, where staff from various industry are invited to come and speak to you. So really a lot of opportunity to get career skills and form networks. So this is just an advert from the career service advertising what they offer, which is they offer a lot of support for PhD applications. We also do a PhD information session early on in term one that is organized within the course, but the graduate service also gives support for PhD applications, and then they offer career fairs, employer events, one-to-one appointments. There's a lot available on their website, so you can take a look at that, including these attribute and aspiration courses, which are really, really great. So there's just some summer reading to finish with that you could do before you start on the course. We also send out a pre-course pack, a preparation pack that you can do before you start the course. Okay, so the website and the email for further information. That's it from the slides, where we'll take queries.
We have been answering a number of your questions in the Q&A chat. Yeah, if there are any additional questions, please feel free to let us know.
Thanks, Henok. There's a question in the chat about, how the MPH differs from MSCs in public.
I'll pick up on this question on the difference between the MPH and the MSc in public health that offered at other institutions. We kind of get this question every year. I think you really need to look at the course offering in detail. But the MPH, has evolved as this professional degree that tries to equip public health professionals for a public health career. Some might qualify the MSc, and I'm not very sure at that, but the nomenclature of courses changes over time. So what used to be MSc in international health, so these days is MSc in global health. But the MPH really is the flagship postgraduate degree for public health professionals. So if there is a course that you've come across that says MSc in public health, what I would advise you to do as someone who's been applying to postgraduate public health degrees internationally is to look at the course structure, the course content, the module content, and how things are organized in detail. I think that's where you can find the answers. I don't think there's a clear-cut answer to that question. Yeah, there's this question about having a full-time job. So that's an occasion where the online offering is better suited because our course over 1 year requires quite intensive engagement with the course throughout. So a full-time job would not be possible. Our students might do some level of part-time engagement, but that's even at a very, very minimal level. In any case, for international students in the UK, that's limited to 20 hours thereabouts per week. But our course is quite intensive, so we do caution students from especially engaging right away before testing how intensive the course is. Jace has her hand up if you want to speak up. There's a question around students with learning difficulties and then the support provided. As Anthony was showing earlier, our support team led by our senior postgraduate tutor, Dr. Jenny Husbands, is very, very proactive in providing the necessary support, and we are further supported by the college-wide disability services department that assesses the different levels of disability and provides the necessary, and we work quite a lot to provide the necessary adjustments within course. There's this really interesting question around our core philosophy around pedagogy. That's the kind of question really that makes us happy because we work a lot around incorporating innovative approaches. You might see slight differences across different modules, but on the whole, it is learner-centered and learner-driven learning. So we don't want students to be passive participants where you just come into lectures and you get spoken to for 2-3 hours. That's why the flipped classroom approach that I described earlier we've been building that over the years. So we have online resources that we ask our students to go and complete. So you get to do, for instance, for the module that I lead in the first term, research methods, we have curated a number of resources like online lectures, online activities that you complete to get the basic grasp of the concept that we'll be discussing. And then we come into the classroom to say, critique an academic paper and try and demonstrate how that specific concept is demonstrated. I hope that answers that question. There's a question around AMR, antimicrobial resistance, and how ICL contributes to this. There are researchers working on that. Maybe Anthony, you want to say something on that?
Yeah, thanks,
You're
Henok.
on mute.
Yeah, so can you hear me?
Oh, you're not. Okay, it's me. Sorry.
Oh, you can hear me. That's fine. And yeah, so we have yes, we have, I mean, we have a range of people working on antimicrobial resistance, probably at two levels, I would say. So we're closely linked to an NHS Health Trust, Imperial College Health Trust, and so they, as you imagine, have a sort of strong focus in their clinical work, both sort of locally and nationally, trying to deal with antimicrobial resistance and think about what we're going to do with that. And but also there's a sort of scale above that, a lot of research, by those same people on, globally, what are the issues with antimicrobial resistance, modeling where that's happening, contributing to surveillance and monitoring efforts, and trying to, I guess, complete that circle also of then trying to develop, new drugs which are going to continue to be effective. Yes, we have quite a lot of AMR work going on.
There is a question around maternal and child care aspect of public health. Again, we have a child health research unit, maternal health. I would encourage you to look at the Georges Institute. They have a lot of global facing maternal and child health work that they undertake. It's a massive school with different departments. So you will have all these topics covered by different research groups.
And so there's a question about vets, and yeah, I mean, quite a short answer is, we've had vets before, and I'm sure we'll have vets again. And yeah, so certainly, that, as a discipline brings in a lot of the sort of skills we're thinking about. And yeah, really, as I think, it's come up a few times in the chat, this idea of sort of One Health is really increasingly central to public health. Just one more about research on the NHS. Yeah, so I mean the answer to that is yes. So like I say, so we have as you would imagine, we have close links with lots of NHS partners, both people delivering primary care and people delivering secondary and tertiary care in hospitals, and quite a lot of students go on to do their dissertations, working on NHS projects. It's I think certainly the last time I checked, the NHS is the biggest data source on sort of health system in the world, because it's sort of unified across those sort of 60 million people. And so yeah, so we work pretty closely with them.
There is this question around why we've gone to 3 modules per stream, which is a great question. So we do adjust our course based on feedback from our students. So there was this feeling that, the problem we're faced with was you have the option of choosing 5 modules. And then if you could choose 2 per stream, then there was this question of, people automatically qualifying for more than one stream. And then the question being, which one do we go for? And students wanted more formalization of the stream, more specificity to the qualification for each stream, which the 3-stream requirement solves with one action.
Question about intercalating medical students, and I see Sylvia's typing an answer and Zainab, you're nodding your head, because I was going to say I wasn't entirely sure, but yeah, Zainab, you think maybe the answer's no.
Yeah, no, you have to have completed. You have to have completed a degree before you can embark on the MPH. We do have students that have done their pre-med and are waiting to start medical school, and then they do the MPH with us while they're waiting for their medical school place, but not intercalating students. We have a global health BSc, but I think that's only up to Imperial medical students.
Right. Well, if no one has any sort of a final question has arrived, and most students are at the relatively early stage of their career, but we do have some mature students. I would struggle to put a number on that, maybe 10 to 15 every year. I'm not sure if that sort of sounds reasonable. I can see Henok, you're nodding. Yeah, so we do have a proportion of people who have come to it a bit later, and they bring lots of great experiences, and that really adds to the student cohort. There's a question about NHS data access. It's it's a process. There are safeguards in place, as you would imagine. But yeah, so for people who sort of do their dissertations in NHS data, we're sort of well versed in sort of going through that process. You have to sort of have written a protocol about what you're going to do, and what the sort of benefits of that are. But yeah, certainly we're well versed in sort of taking people through that.
And then just to add to that, so a lot of our projects that we put up, we also, we also accept student-initiated projects, but on the whole, it's projects that we put up, and these are collated from across the departments, from across academics at Imperial. And they are actively working with a lot of databases that they have established access. So for instance, UK Biobank data, a number of our academics have already established access. So you'll be part of that when you undertake your student project, and likewise for the NHS. So access is facilitated, one, through that, but also we also cover database access, database management, things on research methods and other modules, so that you are primed to apply for the necessary access in time for you to undertake the analysis you need to for your dissertation. Got 4 minutes. Any final questions?
But I was just going to say, while people think if they've got any final questions, the next meeting, right after this, that Henok, Zainab, and I are going to is feedback from the current cohort of students. So, what are their views? We have student representatives, these sort of collect views across the whole cohort. What are people pleased with? And so that's our next meeting, is going to be, I guess, yeah, part of that sort of ongoing process of improving the course that Henok mentioned.
Yeah, just thought that many platforms for you to make your voices heard. So this is the first meeting we'll have, but then there's the postgraduate teaching committee meeting where the same views are discussed across different postgraduate courses. The other thing that we should mention actually is that there's parallelly the MSc in epidemiology and MSc in health data analytics courses running. So you have that opportunity to interact with those students as well. You might share classes, epidemiology, principles of epidemiology shared across, research methods is shared between MSc epidemiology and Master of Public Health students. So you have that opportunity to be in the same classroom with the other courses from time to time as well. Yes, Max, they might have had their webinar, the online M page, as I understand, but I am sure there will be future opportunities. Or if you send us an email, we could send you the recording of that webinar. I'm sure we can sort out something. The success rate of applications to the MPH program, it is a competitive process. Very difficult to put a number on that, but it is a rigorous process where we check the suitability of students. And I know Sylvia has been responding to that question on here. We're not basing our final decision on just one aspect of your application, but your application as a whole. So how you demonstrate your commitment, drive towards a public health career, any experiences in public health research or professional experiences you can bring out and showcase. And that doesn't necessarily have to just only be from a professional employed work experience. You could also show placement, internships, and demonstrate your long-standing interest there, your academic qualifications, your performances in your undergraduate are also evidently important. The references that you'll be sending us, your statement of purpose, where you show us, how you've come to apply for the course, and how you the statement of purpose really, really important, where you can highlight to us why you're suitable for our course. So all this we have application review board. So this, as every student is discussed, reviewed, and final decisions made. There was a question about interviews. Occasionally, we do have interviews, but not routinely. So if there are specific issues that we want to clarify, I would say around 1/3 or thereabouts of applications, we do organize interviews. Is this information available on the web pages? I'm not very sure about the module leaders, but if you can access our module handbooks, and maybe that is something that the course handbook rather, we can share with all attendees here alongside the recording after this. So we could share the course handbook for this year, which details the module leaders for each and every module and everyone who contributes to our course. Yes, application review is not relative to other applicants. It's basically on merit of your own application. That's why we urge applicants to submit your applications as soon as possible if you intend to apply to us, because we look at each and every application. Last 2 years, we've had to run a waiting list, a very long waiting list when it comes to the latter months of the year. But we're not comparing you with other applicants. We are actually looking at the merit of your application. Great. Thank you very much, everyone. We need to go to that student staff committee meeting that we've organized, but thank you all for all your questions. And if you have further questions, please do email us, and we hope to hear from you all. Thank you. Thank you, everyone. Thank you, Anthony, Zainab, Joe, Sylvia. Thank you, everyone, for attending.